Hello, my name is Julius Simon, and I will be introducing to you today the Ministry of Public Health's response application for the fight against COVID 19. The purpose of this application is to enhance the fight that we are putting forward to stem the flow and spread of this virus. Today, I'll be going through just a few features of the application and how you can help in this fight. One of the main purposes of the application is to provide information. So when you access the application using the web address, which is covid19.health.gov.gy, one of the first things you'll be able to do is access all of the available hotline numbers for every region. You will also be able to dial each number with just a single tap. An additional feature of this application is to provide management of the hotline service. All of the calls which go to the hotline will be recorded, and the information will be available to be analyzed by the Ministry of Public Health staff so that they can be able to target the response against the disease. The application also provides the self-check facility, which is a screening tool to enable persons to simulate a hotline phone call. So you will go through the same questions that you would be asked when you call the hotline, and at the end of it, you will be able to receive an assessment of what you should do next. All of the suspected cases are visible and forwarded directly to the health authorities so that they can take further action. In cases where persons are under isolation, the application has a built-in health check facility. Now, this facility enables you to track the vitals of your family on a daily basis if you are in isolation or quarantine. It allows you to indicate what symptoms any of your family members are experiencing and indicate the severity of the symptoms. Any cases that are high risk will also be highlighted directly to the health authorities for further action. The purpose, or an additional purpose of the application, is to enable the generation of interactive reports so that the health authorities can see, manage, and then decide how to act on the information which details the spread of the virus in Guyana. One of the other purposes of the application is to provide accurate, timely, and relevant information to the public. So one of the features that we have is a statistics section which shows the spread of the virus in our locality. The app also includes a feedback mechanism so that if members of the general public have a suggestion or an issue and they want to let us, the developers, know how we can improve the application, the feedback mechanism is there for them to do this. In short, the application is really provided to the Ministry of Public Health and provided by them so that we all can do our best to stem the flow and spread of the virus and eventually defeat it.
Good afternoon, viewers, and welcome to Health 360. I'm your host, Alicia Martin, Ministry of Public Health, Public Relations Officer. Joining me today is Dr. Latoya Gooden. She is the founder of the Given Hope Foundation. Welcome, Dr. Gooden.
Thank you for having me, Alicia.
Okay, so today we want to talk about COVID-19 and cancer patients. Dr. Gooden, could you tell us what you guys are doing down there at the Given Hope Foundation during this time?
The Given Hope Foundation, basically, we have put on pause all of our activities. We are practicing social distancing because we know our cancer patients there are at a high risk of contracting this virus. So we are practicing social distancing. Everything that we're doing now is virtual through the WhatsApp group, and we would have just completed an online conference on COVID-19 and cancer patients. This is where myself, the medical oncologist, the nutritionist, Dr. Fordyce from our U.S. sister-based organization, HERA, and Mr. Will Campbell, our psychologist, had a conference online. We had our viewers on Facebook, everybody, they were able to send in their questions and we responded, and it was very informative.
Okay, how important is social distancing at this time, especially for cancer patients?
At least it's very important. If we want to stop the spread of this virus, we need to practice
Yeah,
efficient social distancing. I put the word efficient there is because some persons think, okay, they can stay home for 2 days and they go out, or they
yeah.
go out and it's just three of their friends, they're saying. But no, social distancing means you stay home in at home, or if you must go out, you go out at least with just one person from your home or no one else. Get what you need and back in.
Definitely. So, can you briefly describe what it means to be immune compromised?
Being immune compromised is when your own body, its immune system is unable to fight or to protect you from different virus, different bacteria. Your immune system has been altered, in other words. You're unable to protect yourself against any threat to your body.
Okay, does a history of cancer raise your risk for health complications from COVID-19?
I would say partially yes, because what happens once your immune system is compromised, your risk increases. But not all cancers raise your risk of being immune suppressed. For example, persons who are diagnosed with a bone marrow cancer or a blood cancer, in other words, such as leukemias, they are at a higher risk because their immune system is weakened. Also, patients who are diagnosed with, let's say, breast or colon cancer, but they are actively receiving chemotherapy or extensive radiotherapy, or even if they had chemotherapy within the past 3 weeks, 3 months, they are also at higher risk, as opposed to someone who was suffering from breast cancer and just did surgery,
Yeah.
or someone who completed their cancer treatment about a year ago. They're not at as much risk as those other patients.
Okay, so does having received chemotherapy or radiation in the past raise your risk for getting COVID-19 or having a more serious course of illness?
Yes, especially if it was within the last 3 months, it can,
Okay.
due to your immune system being altered.
Okay, so for those persons who are watching the program now, those cancer patients, what are some of the do's and don'ts during this time of COVID-19? What are some of the things that they should not do?
Well, let's talk a bit on what they should do first, and then we'll skip over to what they should not do, right?
Definitely.
Earlier, you asked about the importance of social distancing. For these cancer patients, they need to be at home. They need to self quarantine. Even though they have no symptoms, they need to be at home. Now, when I'm telling them to be at home, but then yet still they have a relative who goes out to work every day, that person can put their
Yes.
cancer patient or relative at higher risk. So yes, they need to practice social distancing. They need to use their vitamins, vitamin C, vitamin D, zinc sulfate, use a lot of fluids such as regular water. You can use your orange juice. I know persons are talking about the fever grass tea. Use a lot of fluids, right? Another thing is that we need to wash our hands. We need to wash our hands thoroughly. Not just the regular soap water, you do this and you leave. You need to wash your hands for at least 20 seconds, right? So when you're washing your hands, you basically rub, then you rub the back of your hands, then you rub between your hands. You take your fingers like this so that you get underneath the nails, and then you rub your thumb. My 5-year-old was telling me the other day that you need to wash your hands for 20 seconds. So you count from 1 to 20 and you rub your hands together. And if he's 5 and he understands the importance, right, it's very, very important that everyone, not just cancer patients,
Yes.
or if you're unable to reach the sink and with water and soap, what you can do is use your hand sanitizer. If your hand sanitizer must be at least 60% alcohol based, right? Sanitize your hand, wash your hand after every single contact. So if you just touch a book, or if you just touch a table, or you touch some kind of surface, or even someone, wash your hand or sanitize it. if you must sneeze, I know persons now they're scared of sneezing because they don't want persons to think that they have the COVID-19. So basically, if you must sneeze, I know persons are saying to sneeze in the crease of your elbow. I personally advise that, but I would advise you to use a tissue where you cover your nose and your mouth, you sneeze. When you finish, you take that tissue and discard of it in a bin and wash your hand and sanitize it. Now, this same crease, you probably sneezed in it and then you went and you breathed somewhere and then it gets in contact with other surfaces. So the best thing is to use a tissue and then you discard of it, right? If your relative is going out every day or every other day, once you leave your home, once you return, I don't advise persons to use the regular entrance into the home. Find the nearest entrance that is closer to your washroom, or even if you have a pipe that is in the yard, put your nice soap liquid there. So once you enter into your yard, wash your hands thoroughly. Leave your shoes or your footwear by your door, which is outside. Then you enter to the washroom, change your clothes, go straight directly, have a bath, and then you sanitize down back that area and you go about your regular day. It is important that you do not enter into your home with your shoes because you can bring that, whatever it is, if it's a virus, into your home and you don't want to infect your relative or your loved ones with this disease.
Definitely. If a cancer patient or a cancer survivor feels some early symptoms such as fever, coughing, should they contact their primary care physician right away?
No, what they should do is call the COVID-19 hotline, right? Some cancers, such as the leukemia, can give you a bit of fever, but in a time like this, where we have a pandemic of the COVID-19, you must take all necessary precautions, not just for yourself, but for your loved ones. If you find that you're having fever, you're having a cough, you have a sore throat, please call the COVID-19 hotline. And then they would say if it's not that or if it's that, and then if it's not that, then you come out to your regular healthcare professional. Do
Great.
not go to the hospital with those symptoms.
Okay. If a person is about to start cancer therapy, should they consider postponing treatment due to COVID-19?
Well, that's a bit of a typical difficult topic because we don't want to bring our patients out and then expose them to it.
Yes.
But at the same time, cancer do not wait. It would not wait until COVID-19 is resolved. So that would be depending on the severity of the person's cancer. If it's a cancer that we have under control, well, yes, we can take a little bit of a laid back approach. But if it's an aggressive type of tumor that needs urgent attention, yes, I think we will continue to treat that patient, but with all necessary precautions in line.
Okay, so for those persons who have just joined us on the program, what other advice do you have for them, especially if they have family members who are cancer patients or may have know of someone who is struggling with that as well? What advice do you have for those persons?
Basically, in a time like this where we're thinking about the COVID-19, use as much precautions that you can. Not only are you protecting yourself, again, I'm stressing, but you're also protecting your loved ones. Make sure you follow all of the necessary guidelines that were set out by the Ministry of Public Health and the WHO. If you find that you have a fever, a cold, or a cough, call the COVID-19 hotline. Do not waste time, right? Having a diagnosis of cancer with an altered or an immune system that is impaired puts you at a higher risk, much less if your relative is above age 60, along with cancer, and then they catch the COVID-19. Now, that is very risky. That is very critical for that patient. So what I would advise is use all necessary precautions. Do not just say, oh, I just purchased this from the supermarket. If you purchase your whole grocery, as you bring it in, you Lysol it down. Remember, it was on a shelf. Some persons, they say, oh, I want this milk, and then they touch that thing, and then they say, no, I don't want this one, I want the other one. So they touch that. You don't know what was on there the surface of their fingers. So I would always advise you Lysol everything, or you can bleach it down a little bit. Yes, but please use all necessary precautions.
Definitely. Dr. Gooden, I want to thank you for joining us today on the program. I want to encourage you to keep up the good work that you guys are doing down there at the Gift and Hope Foundation. Thanks once again for joining us today.
Thank you for having us, Alicia.
Hello, my name is Julius Simon, and I will be introducing to you today the Ministry of Public Health's response application for the fight against COVID 19. The purpose of this application is to enhance the fight that we are putting forward to stem the flow and spread of this virus. Today I'll be going through just a few features of the application and how you can help in this fight. One of the main purposes of the application is to provide information. So when you access the application using the web address, which is covid19.health.gov.gy, one of the first things you'll be able to do is access all of the available hotline numbers for every region. You will also be able to dial each number with just a single tap. An additional feature of this application is to provide management of the hotline service. All of the calls which go to the hotline will be recorded, and the information will be available to be analyzed by the Ministry of Public Health staff so that they can be able to target the response against the disease. The application also provides the self-check facility, which is a screening tool to enable persons to simulate a hotline phone call. So you will go through the same questions that you would be asked when you call the hotline, and at the end of it, you will be able to receive an assessment of what you should do next. All of the suspected cases are visible and forwarded directly to the health authorities so that they can take further action. In cases where persons are under isolation, the application has a built-in health check facility. Now, this facility enables you to track the vitals of your family on a daily basis if you are in isolation or quarantine. It allows you to indicate what symptoms any of your family members are experiencing and indicate the severity of the symptoms. Any cases that are high risk will also be highlighted directly to the health authorities for further action. The purpose, or an additional purpose of the application, is to enable the generation of interactive reports so that the health authorities can see, manage, and then decide how to act on the information which details the spread of the virus in Guyana. One of the other purposes of the application is to provide accurate, timely, and relevant information to the public. So one of the features that we have is a statistics section which shows the spread of the virus in our locality. The app also includes a feedback mechanism so that if members of the general public have a suggestion or an issue and they want to let us, the developers, know how we can improve the application, the feedback mechanism is there for them to do this. In short, the application is really provided to the Ministry of Public Health and provided by them so that we all can do our best to stem the flow and spread of the virus and eventually defeat it.
My name is Dr. Mayan Amsterdam. I'm a GMO, a Government Medical Officer in the Ministry of Public Health, Non-Communicable Diseases Department. I have responsibilities for risk factor reduction in my department in the Ministry of Health. In the last few weeks, the novel coronavirus, or COVID-19, has become a subject of global attention and concern. Ordinarily, NCD epidemic accounts for 70% of premature deaths worldwide. Adults with hypertension, diabetes, cardiovascular diseases, and chronic respiratory diseases, especially vulnerable to the coronavirus. As such, we all have a role to play in helping our community and persons affected with NCDs. These are just a few tips for patients or persons that actually suffer from diabetes and hypertension, which are the non-communicable diseases. What we would advise is for them to continue taking their medication and eat a diet or balanced diet as recommended by their physician. We also ask for them to secure a long supply of their chronic medication. Normally, we would actually insist on at least 90 days and up. We also ask for them to keep a safe distance from people with cold, flu, cough, or symptoms associated with COVID-19. We also would like to tell them to cover your mouth with a tissue or the bend of your elbow if you do cough or sneeze, and also to discard of that tissue properly. We also like to emphasize the importance of hand washing with soap and water. What we also would like persons with NCDs to understand that even though they do make up a part of the vulnerable group, this does not mean that if you do contract COVID-19 or coronavirus, this does not mean that you will die. It just puts you at a higher risk of dying if you do contract it. This just means because your body's immune system is compromised by your comorbidity. We also would like to tell them to avoid close contact with persons or anyone showing symptoms of COVID-19. People of all ages can be infected with the COVID-19 or the novel coronavirus. However, studies have indicated the vulnerable groups are persons 60 years and over, persons with pre-existing conditions such as non-communicable diseases, and smokers. Smokers are more likely to be vulnerable to COVID-19 as the act of smoking means that you might possibly be touching your face and mouth more often. And this puts you at a higher risk for transmission, especially if you are in contact with somebody who's contaminated or a cigarette that has been contaminated. So there's hand to mouth or hand to face contact, which increases your transmission risk. Smokers are also known for already having compromised lung capacity, and this may be due to lung diseases or reduced expansion capacity of the lungs, which can also put them at risk for COVID-19. As we all know, COVID-19 affects the upper respiratory tract, and it is a lung or a respiratory disease. I would also like to stress the fact that smoking products that involve sharing of pipes and mouthpiece also increases the transmission risk for COVID-19 in social settings. That is why social distance is important. Distance is important as well as isolation. Since smoking is a condition that increases oxygen needs and reduces the ability of the body to use up the oxygen properly as you inhale it, persons are again at a higher risk. Persons who smoke, that is, are again at a higher risk for contracting COVID-19, which subsequently can cause bilateral viral pneumonia. Some tips for persons that smoke and would like to avoid contracting COVID-19 are: wash your hands often with soap and water, quit smoking, which is the best method, and avoid using coping strategies involving alcohol and drugs. Safeguard your mental health by seeking help or maybe comfort from family members. Maybe take up another hobby. Try to do things that will help to take your mind off of smoking. Also keep a safe distance from people who have a cough, a cold, or flu-like symptoms, or those that might be associated with COVID-19.